I'm Lisa from Beacon Vision. I am the Chief Exec. So I'm just going to give a little bit of background about myself and the organisation, and then I'm going to hand over to my colleague Jan, who will do the same. So Beacon are primarily a sight loss organisation. We do support people who are at higher risk of sight loss or who have other long-term conditions. And we're based in Wolverhampton, which is in the West Midlands, and we cover the Black Country, which is Wolverhampton, Dudley, Sandwell and Walsall, and parts of Staffordshire. And we've been around for an extremely long time, over 100 years, and obviously the organisation has evolved in that time. And in addition to providing a range of sight loss support services, we are also a social care provider. So we provide social care both within the community, so within people's own homes, and at our main centre on the border of Wolverhampton and Dudley, we have a supported living facility with 71 flats that we in conjunction with Bromford Housing, and we manage all of the care provision and all of the wellbeing support at that centre. So my background is I joined Beacon in December 2018. I am in my mid-30s and have always worked in the charity sector. But this is the first time that I've worked in a solely health and social care charity. So I didn't come from a health and social care background, but had worked in numerous roles across the charity sector and worked on programmes that did support vulnerable people and did support people to improve their health. And Jan used to be one of our trustees and is now our health and wellbeing director. And I don't think will mind me saying, originally when she looked at my CV, when I applied for the chief exec, her role was, well, she doesn't have a health and social care background, so I'm not sure she's the right person. Luckily, I managed to wow her in my interview and convince her that I could do the role. So obviously not coming from a health and social care background, that was a learning curve for me when I joined the organisation. And we do a range of support, kind of got to grips with sight loss. I felt, we'd got really good connections through the Visionary network and was understanding social care more and more. In March of this year, we had got a contingency plan in place as to how we might continue to support people with sight loss, and specifically how we were going to maintain social care. So we are a CQC regulated service, so we have legal requirements to maintain a service. So the week before lockdown was announced, we made the decision that we were going to put a training programme in place to train staff from non-front-facing frontline roles to be able to support front-facing roles. So that was both care and also supporting our most vulnerable, who we support through provision and other programmes. We finished that training, so I volunteered, so it was not mandatory, it was a volunteer process. There were about 15 of us who volunteered. I finished my training at 12:30 on Friday the 20th of March, and at 4:30 on Friday the 20th of March, we had a notification that one of our residents who had been in hospital, returned to the main centre and then taken back into hospital, had tested positive for COVID-19 and had got pneumonia and was very sadly very likely to pass away. So we were informed by their family members of that, not by the hospital or by any NHS partners. And at that point in time, the guidance was if you had had contacts with that person for more than 10 minutes, you needed to self-isolate for a minimum of 7 days to see if you got symptoms. At this point, there was no PPE provision for social care, so none of our staff were in PPE. So that knocked out a third of my care team, including my registered care manager. So we were literally thrown in at the deep end. So me and 2 of the managers within the health and wellbeing team were on site until 11 o'clock at night that night, providing frontline care and planning what we were going to do over that weekend. And ultimately what happened was that I moved into the centre. So I lived at the centre for about 5 or 6 weeks on a camp bed in an IT training office. And I worked frontline in the care team, both actually frontline, hands-on, working alongside our health and wellbeing assistants and supporting the care management in the day. And then I did my chief exec job at night. And there were lots of conversations about, was that the right thing to do? And ultimately, my view was I wasn't the only one doing it. So my volunteer manager was there, my community development manager was there, my executive support manager was there, my finance manager was there. So we had people from very office-based roles who were multitasking, because ultimately we had to try and keep these people safe and alive. And care is something that not everybody can do. And actually my view is I can do that. And I see somebody who is in a difficult situation, maybe they've soiled themselves, maybe they can't find their medication, maybe they're confused. And my initial response is that I need to support that person. Other people can't do that, and that's absolutely no criticism. We're all very different, but you can't put people who can't do those roles into frontline roles, because it doesn't give dignity to the person you're asking to provide a frontline service. It doesn't give dignity to the person you're supporting. Very sadly, we did have a second outbreak in the centre, and we lost more of our residents. So we lost a number of our residents, and we lost people in our domiciliary care provision to COVID. We lost people that we supported on a day provision programme. We lost volunteers. And at the worst of it, in a frontline role, I used to sit in our day provision room, which has a big corner window, and have my laptop and be doing my CEO work and trying to eat whatever the team had brought in for me to have for my tea, because they're fabulous and all looked after me. And you didn't see any cars, but you just saw ambulances. And we regularly had ambulances on site to people. And the response from them was, do not let these people go into hospital. They have a long-term condition, and if they cough or have any symptom, they will immediately put onto a COVID ward. And if they don't have COVID when they go in, they will have it by the time they've been in that ward, and they won't qualify for a ventilator. So we were in a situation where our main centre was locked down, and we were having to pass messages to family members. We were having to explain to them that actually going into hospital was a dangerous situation, and they needed to understand that, and they needed to understand that they would not be able to visit their family member in hospital. They couldn't visit them here, but we were with them. So we had a lot of very difficult conversations. And I would say my knowledge of the health and social care system accelerated at vast speed within that period. And I probably know more now than I would have known in 10 years of working in a job as a CEO, because I had to live and breathe it at every level, you know, and I was online while also having conversations with directors of public health about how we were managing testing and what we were doing in terms of managing outbreaks, and speaking to GPs and psychiatric teams about what the individual response was for people. And we will all have had a different range of engagement with people, but for Beacon, we made some very significant frontline decisions. So people will be aware of the Emergency Powers Bill that came in that effectively repealed huge amounts of the Care Act. Even in local authorities where that wasn't formally enacted, in effect it was in a number of places, because they, like every other organisation, were short-staffed and were having to learn about a new situation and were having a massive increase in workload. So we had a number of people who didn't have social care assessments, didn't have reassessments, didn't have appropriate discharge assessments. And we made a decision as an organisation that we would provide the care that those people needed based on our registered care managers' assessments. And we would then work out how we were going to get paid for that at a later date, which ultimately, as an organisation, is quite dangerous to do, because there was a risk that we wouldn't be paid for that provision. But we felt that morally, as a charity that was there to support people with sight loss, we couldn't leave these people. And, you know, we did do that. And luckily, we did manage to get paid for the majority of the provision we did. but not everything. So my staff were on site 7 days a week. There was generally a manager on site 24/7. So it wasn't just, I was the only one that was daft enough to sleep on a camp bed, but others of my managers slept in respite rooms, slept on treatment beds, so that they were there if there was an issue, because we didn't want to leave our care team on their own. And ultimately that meant that there was never a point where we couldn't deliver social care. There was never a point where we had to say to CQC we didn't have staff in place. And my care team were amazing. So they moved out members of their family so that they reduced the risk. They didn't see family members, they didn't see grandchildren, they didn't see their children. They worked double shifts, they worked night shifts that they'd never done before. They did everything, and we did it as a team. And I think that's why it happened. We were all on an equal pegging, and we were all looking at what was the impact we were going to make. And I was very open with my team about how miserable it was and about how dangerous it was. So we did not have PPE at the beginning. The PPE guidance would change continually. You now get, if you have a positive patient with COVID-19, a fluid repellent mask, a visor, but they're not provided, you have to make them or get them donated, and a plastic apron and a pair of gloves. That is massively downgraded from what it was initially, and it's massively downgraded from what it is provided in a hospital environment. But there were huge swathes of times where we did not have enough PPE, and I had to be very honest with my team that I couldn't guarantee that we had the right PPE. We had everything that we could give them. We wouldn't put them in a dangerous situation. I would put myself in a dangerous situation before I put them in. And we were doing everything we could to secure that and to keep them safe. But the guidance changed continually. And that is still an issue. PPE is still not provided in social care. It is still a continual issue for everybody. The winter care plan states that everyone should have PPE, and you should be able to have it as a frontline care or social care provider. Those still aren't provided, and those are things that people you support may well bring up and their family members may well bring up. And I've probably waffled on for far too long. But ultimately, yes, it was really miserable. And yes, I did cry quite a lot. And I was quite open with my staff that it was miserable. But we did it. And we are most likely to have to do that again. So the hospital situation where we are is worse than it was in the first wave. We have one hospital who's already declared a state of emergency, that they have zero capacity to take anybody into their hospital. So we are likely to have to do it again, but we've learned lessons. And I think this is what we want this session to be about. We're very open and honest as an organisation and individuals, and we want to kind of share with you the things that we've learned that will maybe help you as organisations and individuals and the people that you support. So I'm just going to hand over to Jan to give a little bit of a background about her role and her experience and what she did in that period. And it will become very apparent that Jan's knowledge of the health and social care system is significant. Okay, I'll hand over to you, Jan.
Right, it's the Jan and Lisa show, isn't it? Are you enjoying this? Are you all thinking, my goodness me? We're only wanting to help you and to share with you our experiences, but I am sure it resonates with some of you what we're saying, because you may have been through it yourself. And if you haven't, look out, because it could come your way. My background is, yes, I was a trustee, and I would say I've delivered care and enjoyed being a Meals on Wheels driver was where I started. And it was at that point when I was a Meals on Wheels driver that saw the degradation and the isolation that people were living in that made me think one day I might be in a position to make a difference. So I've had a bit of a lifelong journey to be able to be where I am today, or where I've been. So my background is delivering services. I've done home care. I've run a home care service. I've inspected services. I'm a registered social worker, still registered. Got to give my up-to-date CPD stuff, but there you go. And I've worked in local authority for 25 years, and I used to be principal officer for learning and development for 2,000 staff in Wolverhampton. You might tell by the accent, not a million miles from the Black Country. And also I did moved across because I was working on setting up different little pockets of organisations to be able to make a difference, not only from a local authority perspective, but from providers' perspective, of doing some amalgamated working or collaborative working where people would start to work together to pool resources, which was about just not people, but funding as well, so that providers who were on the Cinderella services would get access to funding, which would help people to be then able to train their staff. And obviously we have to enhance quality. I've also then worked for Skills for Care. I worked for Skills for Care for 6 years, and I was started off as an area manager and ended up virtually as managing all 9 regions in Skills for Care. So I've looked at occupational standards as well. Work very closely, and I'm chair of the National Dignity Council, still in a voluntary capacity. Yes, I do put a brush up my backside and work with it, but you'll be okay. And I will as well. Like Lisa, you have to get stuck in, don't you? But yes, I've worked with Skills for Care, as Skills for Care, but it was at that point that I was asked to be chair of the National Dignity Council, and there I've got a great relationship with CQC, because they obviously would take dignity at the heart. And that puts us to something that Lisa said earlier. You don't just come into this job because you might get paid well. You come into this job to make a difference to people's lives. And that's exactly why, as a trustee, I came into Beacon, because of their values, because of the difference that they want to make to people with sight loss or impacted by sight loss. But when a little bit of a hiccup came and they needed somebody to help out last October in the directorship role, I took it on in an interim role, but little did I know what that meant in terms of COVID coming in, and crikey. And also because I'm not in my 30s, but I am a bit older than that, so I was working from home. And what does it feel like to work at home? It's a very new, well, I've worked from home before, but not that you're on lockdown at home. And being able, not, you know, wanting to be somebody who's always been on the sharp end, delivering the service, getting stuck in, not being able to do that. What do you do about that? What you do about that is be the eyes and the ears and the listening voice to those who are wanting to come to you, but being one step of the head of the game. And I was the one who was doing the research to find out what's the guidance this Friday, what difference will that make on Saturday morning, and where do we put systems and processes into place to be able to make sure that Lisa's there delivering, Lisa's there as listening to what's going on. And obviously that was fantastic, but looking at the strategic aspect and the implications of what is going on here. And what we had to do was recognise, from a supported living perspective, we were becoming residential care, because people were disempowered. People were thinking, oh my goodness, you know, I need a service. Where's it going to come from? My family are not coming in. And as Lisa said, what we did was take on board that people, never mind whether they'd got social services assessments, they still needed a service. And who's going to turn their back on that? Not Beacon. And certainly the idea was, what does that mean? Let's get stuck in and let's face the consequences later. But all along the line, it was risk assessment. It had to be risk assessment in everything that we do. And everything that you'll ever hear me talk about was, have you done a risk assessment and what does that mean? From the smallest moving and handling to the largest COVID, a business continuity plan, the whole thing had to be taken account of. But the service changed its direction. We got a profile from it, as social care has, and that heightened the profile that Beacon Care and Beacon are there, because we have since heard where some of the services from other local authorities have told us that some of the services have actually just furloughed everyone and not provided a service. So we took advantage, and yes, there were some real negatives about it, about COVID. Of course there was, especially when you were losing people, the fear factors, the mental health, the immobility that it was affecting people. It was my job to actually keep on looking as a visionary about strategically with Lisa, what's going on, what does this mean, and what will it mean to people going forward when we've got to drive on at the end of this period. So we even restructured. We decided to restructure the services because we learned lessons. We learned lessons about what do people actually want, not what we think they want, but they were telling us, because we were closer to them, about what they do want. And we were able to identify need and meet need in a more bespoke manner. and bringing on customers that we hadn't had before. And obviously we're going to look further at what it means in terms of fighting the local authorities and the health services and being advocates for people that need it. So we've worked as a team, people at the forefront, on the front line, as you might say, but lots of people like me in the background thinking, oh, I ain't going to twiddle my thumbs anymore, or my fingers. What can we do to make sure that as Beacon, we were connected, but at the same time, most importantly, that we had the people at the heart of what we were going to deliver, and that we were keeping them as safe as possible. I think that's enough of me.
Right, Jan, thank you. So I hope that gives a general overview of Beacon and a bit of a story about the immense challenges we faced. We're going to do a couple of polls, which I've not done before. So Andy is going to be the poll master, just so we've got a better idea of what the experience is in the group. And then we're going to break out into a couple of breakout rooms is the word I'm looking for. Okay, so Andy, can you do the first poll, and can people just select their options? Here we go. Hopefully this should work now. So if you can just click one of those three options as to what your role was during the COVID crisis so far.
Please don't be shy. We can't tell who's voted where, and we won't be getting in touch to disagree with what you've said. So please just feel free to click as you wish.
Yeah, as Andy says, it's all anonymised, but I will ask Andy when the results are in, just to give us an overview of how many people we've got in each of those three groups.
Okay, so we've got 100% of people have voted, so thank you very much. So to give you that feedback, Lisa, a third of the group delivered frontline care or clinical services as part of the charity's core activity. 10% were involved in advocacy or support for sourcing care or clinical services as part of the charity's core activities. And 57%, obviously the biggest majority by far, had no current involvement in care or clinical services but want to find out more.
And you'll note that we didn't give you an option. If you weren't involved, you had to say that you wanted to find out more. But by virtue of being on this workshop, that's probably the solution. Okay, we're just going to do another poll before we go into the breakout groups. And this is to find out what your role was during the first wave of COVID. So the poll master, Andy, will hopefully be able to, yeah, there we go.
There we go.
So whether people were frontline, providing a virtual provision, so that could include working from home, or actually if you were shielding, or if there was another restriction that meant that actually you couldn't engage with people.
Okay, so there we go. Virtually everybody's voted, and that's the results on the screen there, which I'll read out for people who might not be able to access that. What was your role during COVID wave 1 was the question. And 15% said frontline face-to-face support and care, 72% virtual support and care, and 13% shielded.
Okay, thanks very much for that, Andy. So we're now going to split into two groups. We have already split people into these groups based a little bit sometimes on our knowledge of you and what your role is. And equally, if we've got more than one person from an organisation, we've tried to put one person in each group. But as Andy says, everything's been recorded and everything will be shared. So we're going to go into two groups. I'm going to do a session that looks at the emotional impacts of being involved in frontline, and that impacts on staff as well as the people we support and their families. And Jan is going to more on the state of social care and our role in delivery and advocacy. So both Jan and I are going to share some of our experiences around specific individuals. We are not going to anonymise names because it's too confusing and we'll forget who we're talking about, but we will only be using first names. So obviously be conscious of that. All of the people that we'll talk about, either themselves or family members, are aware that we share their stories and they're quite happy for us to do that. We will also be asking for your feedback as well. So the way that we're going to do that is when Jan and I are asking questions, we will ask you to put feedback in the chat function in those breakout rooms. And then whoever's facilitating, either Jan or myself, will invite individuals to kind of share something that we think might be beneficial to the group. So you'll have to unmute yourself to do that. We have got about 20 minutes for it. This workshop is going far faster than I thought it would. So we might not have the opportunity to share everything, but I think equally, you know, one of the things that I would say would be useful, then actually, if there are people that share comments that we think actually that's something that's really interesting, but we haven't got time to look at it, we may well come back to you and ask if you don't mind just putting a little bit of information together that can go out with these notes. So Andy is going to try and now randomly put us into breakout groups, which should somehow happen by magic, hopefully. He's just doing it now, is what he's told me on here. Yes, so should now have a little pop-up asking you to join a breakout room. So if you just click join on there now. So we're all magically reappearing now. Jan will laugh at me. So I am completely technologically hopeless. I don't even have a television in my house. So for me, I'm like, if I can work something, it's positive.
You don't even watch Celebrity. Get me out of here.
Don't have time. Okay, so I think everybody's back. So we've just got kind of 5 minutes where we're going to do a little bit of feedback, and then I'm going to do a little bit of a poll at the end and a summing up. So Jan, do you just want to give a quick overview of your session and any kind of key points that came out of it?
I think the main thing I would say was about the assessment process and having your act together, planning, being able to have all the detail that you need to be able to go to the authorities, whether it be the NHS or whether it be the local authority, that you actually understand the language, that you have, and I went through the SPICES acronym for them to understand the assessment process, which for everyone else here, I'll just very quickly go through. It's social, physical, I'm checking those who were in the session now to see if they're nodding to understand, intellectual, cultural, emotional, spiritual, and not to forget sexual needs. And the assessment process you should undertake that so that you have your act together when you have to leverage using legislation wherever possible, such as health and safety, such as Care Act, particularly the Care Act and the 9 principles within the Care Act. And actually be able to then have more power to support the individual and make a difference to them. One of the things that came up as well was recognising what we have been through and the complexity of what we've been through, but equally the impact on staff, and that what some of the ideas, particularly the big C word in terms of communication, and making sure that we're regularly communicating with people and using person-centred, not only for the people who use the services, but person-centred for the staff as well. I think that was it.
Right, Jan. So
you're wobbling, Lisa.
Struggling with your audio, Lisa.
We talked sadly about. It says, is it all right now?
Yeah, I'm going to turn your video off just to make it easier. There we go. Thank you.
Okay. So, well, that's quite apt because we did get a bit wobbly in our session, and we did have a few tears about people that we'd lost and the impact, both where we'd been frontline and where people have been supporting people remotely, and that talks about that actually that's something that we as a sector need to recognise, that there is a significant emotional impact on us as support staff, and how do we come together to support each other and also to support the carers that are looking after people, or for our members who do also have caring responsibilities. I think, you know, we also look for the positive. We have all adapted very quickly to different delivery methods and different roles. And I think very aptly for the final poll that I'm going to get us to do, Debbie was saying actually how we've got a much better working relationship with other organisations, so statutory and other community organisations, and they're recognising the value of what we do, which, you know, we've got to look for that silver lining wherever we can. So I'm just going to do one final poll before we close the session. And this is about how connected do you feel to colleagues? And by colleagues, I don't just mean your colleagues in your organisation, but that might be social services, that might be visionary colleagues, that might be NHS colleagues. So how connected do you feel with them, and how much do you think they understand your position and what you're doing? So is that the same as before, more than before COVID, or less than before COVID? And when we've got the scores on the doors, oh, look, this is our host is showing results. So I think the results there are that 19% say it's the same as before, 25% say it's less than before, and 56% say that it's more than before, which is positive. You know, that is the biggest group, but obviously there is still a quarter of us that are saying they feel less connected than before. I think for me that the kind of two takeaways from this would be that actually, you know, COVID does provide us with an opportunity to connect with colleagues across social care and to demonstrate that there are different ways of working to support people. And I think we will share as much as we can around both the assessment process and new opportunities that are coming. But also, we need to be kind to ourselves, because let's be honest, this is really shit. And this is a really difficult thing to do. And there are days where you don't want to get out of bed, and the days where you want to cry. I did have a couple of tears. I've been quite open. I've cried in other visionary sessions when you just feel like this is just a bit rubbish. And I think we've had conversations at a visionary level about actually what can we do to support each other emotionally. And whether that's within our organisations, or sometimes you can't do that in your organisation and you need to reach out to someone else. Both Jan and I would say, you know, our emails will be shared. Get in touch if you want support. Either you need to pick up the phone and have a rant, or you're just having a bad day, or equally you want support from an assessment process point of view, or you want support of how to deal with social services, or get the right support for someone from an advocacy point of view. I think the fantastic thing is that we are not just individuals, and we are not just single organisations. We are a whole network, and we can reach out and support each other. And I think that would be the kind of takeaway that I would take. You know, we can adapt, we can do things on the front line when we need to, and we can do things remotely, but we're not on our own. So just a huge thank you for coming along. Thank you for Andy for setting this up. If anyone's got any specific questions they want to raise with me and Jan, our emails are in the packs, so send them out, and good luck and enjoy the rest of the conference.